This video will look at the surface of the heart. The first portion will be the anterior exterior surface anatomy of the heart. At the top there, that's the right brachiocephalic vein, and the other branch there would be the left brachiocephalic vein. Those two veins collect blood from the head and neck and arms and carry it down to the superior vena cava and into the right atrium there. They're blue because it's carrying deoxygenated blood into the right atrium. Next, across the ventricle, separating them is the anterior interventricular sulcus that will contain coronary arteries and veins on its surface. That's the right ventricle there, that whole area, that entire area. And the point here is the apex of the heart, that is an extension, a pointed extension of the left ventricle. And all that area there I'm circling becomes the left ventricle. The left atrium there here's the left anterior descending coronary artery in red. It's a branch of the left coronary artery. And here's the lateral circumflex coronary artery, both of which carry blood from the aorta and into the ventricular myocardium. The deoxygenated blood is returned from the ventricles into the anterior intraventricular vein. Those structures there carrying blood into the coronary vein that lies in the coronary sulcus, a groove that goes around between the atria and the ventricles around the heart. The pulmonary trunk there in blue carries deoxygenated blood from the right ventricle toward the lungs. This branch is the left pulmonary artery, of course going to the left set of lungs. And this would be the right pulmonary artery going to the right set of lungs. In white there will be the ligamentum arteriosum. That's a non-functional structure that's left over, that remains from the ductus arteriosus from the fetal days. Next is the aorta, this main red artery carrying strongly oxygenated blood from the left ventricle out to the body. Then the blood returns to the left atrium there through the pulmonary veins back toward the heart. Now for the posterior view of the heart. Starting first here with the left atrium, a dominant structure in the posterior view. These are the left pulmonary arteries returning blood from the left lungs into the left atrium and thus the left side of the heart. And then these on the right here, these would be the right pulmonary arteries, then of course returning blood from the right lungs into the left atrium or the left side of the heart. The inferior vena cava here cut off, but the pointer is being placed into the vena cava that goes into the right atrium. Here's the superior vena cava that brings blood down from the head and neck into the right atrium. This would then be the left pulmonary artery carrying blood to the lungs, and there's the right pulmonary artery carrying blood to the right lungs. Here's the coronary sinus, which is really a vein without valves returning blood into the right atrium. It resides in that groove called the coronary sulcus, this restriction that goes all the way around the heart between the atria and the ventricles, and eventually returns blood to the right atrium in the coronary sinus.